Greg came to us with chronic pain and deteriorating health. The back pain was limiting his movement and contributing to the progression of the disease. I'm really excited that through MSC therapy and guided PEMF, he was able to achieve complete pain freedom.
My name is Greg Bell, born and raised in Columbus, Ohio. Was drafted in the first round by the Buffalo Bills. Played a total of 8 years in the National Football League, and went from the Bills to the Los Angeles Rams and to the Los Angeles Raiders. And most people don't know I actually finished my career with the Green Bay Packers. When you're a running back, you're going to take a hit every play, but probably the biggest toll for us is really practice. We hit every day back in the 80s, twice a day during training camps. And I actually herniated 2 discs in practice. From that point, for about the next 5 years, all I did was inject it to take the pain out, and I played with it. Driving home from San Diego with my family, my leg decided it was gonna go numb, and it was done. I had emergency surgery on my lower back. It pretty much, the nerve had just been compressed so long, they just needed to do the surgery and relieve the pressure. Had a discectomy on my L4 and L5. And I think I probably overcompensated. I mean, that's what my doctor told me when he cut me open, that my back muscles had become so enlarged. He basically, after I had my surgery, I was bedridden for almost 3 months. They put me in a traction bed in my house and said, just relax, take it easy, because if you spasm, you're gonna throw the rest of it back out. But now, all of a sudden, at 50 plus, I could barely touch my toes, and the pain shooting down my back, actually got bad to the point where it started shooting down the left side. And that just told me either it was gonna be a fusion or I had to look into something else. I decided, okay, I gotta change life. Before I walked into the clinic, I was probably weighing about 280. And it was really a weight issue. It just stopped me from doing the things I normally did. I'm probably down to about 260 now in about 8 weeks, since I really started the diets and all the other stuff. But I can run again now. I don't have any pain. I told Dr. Ace, I said, she told me, we do MSC, which is the cell regeneration. And I kind of looked there and says, well, what is that? She says, well, we inject these cells, and basically, it helps your body correct itself. And when we did the injection process, it was kind of funny and I woke up that next morning, I was like, man, let me go on out for a walk. I feel pretty good. And so I think I did about like a 6-mile walk. And during the walk, I started, bouncing on my toes a little bit. I was like, okay. So I came back Saturday, I got up. I was like, I'm going back out for another walk. I think it was probably a week after that I came back in. And so Dr. Ace looked at me, she said, what would you say to pain? I said, Doc, I don't know if you just hit the spot, you hit everything on the right spot or not. I said, but I haven't had any pain. And that's all that really mattered, because the pain down my nerves were driving me crazy, especially when they wake you up in the middle of a sleep. And so I have had no pain now since the point of injection. PEMF, thank you. Give me the acronym. Yeah. But no, all that STEM that we've been doing, I mean, that alone is interesting to me, because it's almost like it's going through her. Just the STEM piece, I wish I could get that at my house. And so, I have a pulse machine that I use all the time. I haven't used it at all. The treatments, the supplements, and it's kind of funny because, people talk about, you go in, you look at all the vitamins, and there's a difference in vitamins and a difference in supplements. I don't tend to understand a lot of the supplements, but as she explained it, the things that help your body heal, because it wasn't the medication just that she was putting in. It was basically activating your own blood cells to get them to start reproducing, start healing themselves, and they needed some help along the way as well. So, it's just the program itself was. I would recommend that program for whoever's dealing with pain that they just can't find the right. If all they thinking is the remedy is another surgery or a needle, it's a different type of needle, put it that way. It gets to the point where I tell most people, money over matter. If the money means more to you, you put it in the bank, I guess. But if your health means more to you, you better spend the money. And I just decided it was time for me to do what was best for me for the long haul. My dad's going through a lot at 85, And I think at 58, I better start reversing so that when I eventually become 85 years old, I'm still in the best of health I am today.
Having gone through chronic pain myself and benefited from regenerative medicine, I know firsthand how liberating it is to achieve pain freedom. I'm so grateful that Greg gave us this opportunity to work with him.